And the Department of Health and Human Services under Secretary Robert F. Kennedy, Jr. is announcing this week that they will initiate a sweeping overhaul of the nation's organ donation system due to what they call a horrifying ethical failure. Joining me with analysis of this development is neuroscientist, senior ethicist at the National Catholic Bioethics Center, Father Tad Pacholczyk. Father, thank you for being here. HHS conducted a 4-year investigation into the nation's organ transplant system, which revealed systemic ethical and safety violations. In a June 21st press release, the HHS Secretary Kennedy stated the following. It revealed that hospitals allowed the organ procurement process to begin when patients show signs of life. The entire system must be fixed to ensure that every potential donor's life is treated with the sanctity it deserves. Father, the HHS found systemic disregard for sanctity of life. What's going on here?
So, Raymond, I'm very pleased with this initiative, I have to tell you. I was delighted just to see the title of the press release and the use of the term sanctity of life. I was thinking to myself, boy, did we hear that under the Biden administration? Not really. And, then rather strong language coming from HHS Secretary Robert F. Kennedy, Jr., because he referred to the fact that potential donors' lives were being treated in a bad way as horrifying. In other words, that they showed signs of life and they were still moving ahead with procuring organs. So horrifying is a strong word. What this does, in my opinion, this puts the organ procurement organizations on notice. And in my opinion, this is something that has been long in coming. I'm glad to hear that this study has 4 years of digging, in the background. I understand some of the findings that had previously been looked at by the Biden administration were sort of sidelined, but it sounds like some of those are being, reinvigorated and examined again, which is so important to be sure that justice is done to potential donors here.
Father Tad, the Church teaches in the Catechism that organ donation after death is a noble and meritorious act, while establishing ethical guidelines for the need for free and informed consent. Explain the Church's ethical stipulations and how current practice in the organ donation and procurement system can or has violated those guidelines.
Yeah, so, the key rule here we call the dead donor rule. That's what the Catechism is touching on. We have a real obligation to make sure that life-sustaining organs are never removed before the donor is properly determined and declared to be dead. And also, of course, the obvious corollary to that would be that donors of organs cannot be killed for the purpose of obtaining their organs. So the HHS report indicates that there has been some clear failures in procedure here. And some of the follow-up that I've seen on this, there have been workers in various states who have reported that some of these coordinators for the organ procurement organizations have been persuading people in hospitals to, administer higher doses of morphine or other drugs to hasten the death of potential donors, those kinds of things. And of course, that's strictly forbidden by the dead donor rule. And, you mentioned consent. The Church is very strong on this. This is a voluntary choice that individuals can make. There's no obligation to do it. We should not have a position like they do in Europe where there's implied consent, which means if you drop dead, they can come and take your organs. No, there's a need to get that consent ahead of time. And if not, then from your properly appointed proxy, the person who makes your decisions because you're unconscious or brain dead. You need to be brain dead, actually, in order to donate. But you can have, you ask about how is this done? You can have a situation where a person is very close to death and they are clearly on the way out. They're on a ventilator and a decision by the family is made to remove the ventilator and wait till the person passes, which can happen in a matter of minutes or maybe in an hour or two. And then at that point, after waiting at least 5 minutes, that's the bare minimum, the doctors are permitted to go in and start extracting organs for the transplant, assuming again that consent was obtained. Now, I mentioned the 5 minutes. This has been another problem that the HHS report alludes to. Some places look like they're doing 3 minutes or less. And, you have to be sure, you have to what we call moral certainty that the person is deceased.
Yeah.
You do not want to start cutting when they are not yet deceased.
Well, these organ procurement organizations, they take a number of things into account when they obtain organs for eventual donation or transplant. And brain death, circulatory death, those are the two, benchmarks. But there have been violations that the HHS found, literal ambulance chasing and, jumping ahead, as you mentioned a moment ago, to obtain these organs. What is driving all of this? I mean, is it to preserve the organs in their best state, or is this related to a financial motive?
It's probably both. I mean, when you think about what these organ procurement organizations are up against, they're called into the hospital. When they get there, they don't want to have a kind of, failure to achieve their goal. They don't want to have to be sent back home again. So as soon as they're there, they're very eager. Some people, unfortunately have said they're even a bit like vultures hanging around waiting. The procedures here are easy to violate. They can apply pressure in a manner that they really shouldn't. And so I think the protocols, there needs to be a certain strengthening of this. And, what this means practically, Raymond, is there needs to be first increased monitoring of how this is done. There need to be improved safeguards in the whole process.
Well, I was just about to ask you, what are the safeguards that HHS is proposing here to stop this abuse? And what safeguards are already in place that obviously people aren't paying very much attention to?
Well, one of the safeguards that's already in place is that the organ procurement organization doctors are not supposed to be in touch with the healthcare team who's taking care of the person who's dying or has just died. That's supposed to be, two separate channels and wires that don't cross. And hopefully that's the case, but I have heard stories where sometimes those wires do get crossed. In terms of, changes that they are requiring, it looks like the HHS is going to mandate that the organ procurement organization carry out a full kind of root cause analysis of all the violations that you and I are talking about here, including this, non-compliance with the 5-minute waiting rule after the patient's death. And I think, the reason a lot of these organ procurement organizations may rush things is they say, well, these people are going to die anyway. They've agreed to be donors. Why do we have to wait 5 minutes? That sort of thing. But of course, it's very important that we do. And there's also this new thing, which I think is a very good safeguard, which is that the organ procurement organization has to adopt a formal procedure so that if there's a staff member there who's helping out with the donation process and they see some kind of a safety concern, a violation, they can halt the whole process. So, in other words, Raymond, what I think is important here is we need to err on the side of caution. Life is so sacred. We want our whole medical institution to reverence that life right up until the point that it has passed out of this world and not begin anything preliminarily.
And Father, are you confident these reforms will fix the problem? I mean, can the system be trusted? And what do you make of the temptation of a lot of these procurement organizations and hospitals to cut corners and skirt these ethical regulations?
Well, I have to say, Raymond, I'm not confident necessarily, but I'm strongly encouraged. Let's put it that way. The fact that this is coming into full broad daylight, this is great. This is something that should have happened, much sooner, in my view. So, will it fix everything? Will it make the system perfect? No, nothing ever does. I mean, we always have flawed humans, even as physicians, who are mediating this entire process. But when you set up good safeguards, improve accountability, I think that what's going to happen here is we are going to move towards a restoration of trust. And this is good. We want to be able to trust our healthcare professionals. So this is what I consider to be a fairly sweeping reform. And, it really could be a plus all the way around.
As I read this press release and as we're talking, I'm thinking of people I know who have living wills, do not resuscitate orders, or, even denying themselves hydration and nutrition, allowing the health provider to basically make that call. When you couple that with a donation, be it implicit or not, with a donation of organs. There seems to be a conflict of interest there, Father, don't you think?
I would agree. And what you're pointing out about allowing the healthcare team to make decisions about providing nutrition and hydration, that's something we should not be encouraging, Raymond. Instead, there needs to be the properly appointed healthcare proxy, somebody who loves you, who cares for you. They can make those decisions together in consultation with the healthcare team, but
Yeah.
you should not be handing this over to the doctors and nurses. They are not the ones
Yeah.
who are going to have, automatically the best interests of the patient in
Well,
mind.
particularly if you've got an incentive here where you've got the organ procurement people waiting in the hallway. There's an incentive to move things
Exactly.
along, free up the bed, and get the organ out. So, all of this is very troubling to me, I have to say. But I thank you for bringing light and some hope to the situation. And you can find Father Tad Pacholczyk's commentary on the National Catholic Bioethics Center website, ncbcenter.org. Thank you, Father Tad.
Thanks so much, Raymond.